Hey again, Facebook. Welcome back to Reality Bites. I am Dr. Samantha Rodden with New York Smile Specialist at Gallery 57 Dental, and today we're going to be talking about the at-home orthodontics trend. As always, if you have any questions as we move through our segment today, please feel free to write them in the comment section right below our video. All right? So, the do-it-yourself orthodontics trend, I don't know about you guys, but I feel like I have just been inundated with advertisements in the subway, on social media, on all different websites of people selling these clear aligners that promise to straighten your teeth at a fraction of the cost of a private office. For those of you who aren't so familiar with this trend, basically these companies send you a kit where you can make your own impressions, you ship it back to them, and then they send you a series of true aligners. Kind of seems too good to be true, right? It's because it kind of is. So we had ordered one of these impression kits, just so you can kind of take a look here, and it comes with two trays, one for the top, one for the bottom, and then these putties that you mix together for the impression. And they actually send you two sets just in case you missed the first one up. And right off the bat, I see a whole bunch of things wrong here because, making impressions on yourself is not an easy thing. They do include some instructions inside the box for you, and they also give you a link for some videos that you can watch, but there are a few things that I'm going to go over with you right now that I don't love about this system. So first and foremost, they only send you one size tray. These are not one size fit all. Patients have different size mouths, different widths, heights, things like that, and these size trays don't necessarily fit everybody. They do say that if the tray doesn't fit, that they'll send you a new set. But besides it being too tight or too loose and not being able to fit it in your mouth, it's really hard to know whether or not these trays will reach all the way back to cover the last tooth in your arch. And once this is inside your mouth, how in the world are you supposed to know whether or not your last tooth is covered? So that's the first thing I don't love about this. The second is the chance of you making a good impression on like your first or even your second try is not so likely. So basically, I'll just put it this way for you. I did a 4-year program of dental school, a 3-year specialty program, and even I have to remake impressions sometimes. So the chances of you guys making it on your first or second try, not so likely. All right, so if you don't like the make it yourself impression technique at home, this particular company that we had ordered this kit from actually does have a few brick and mortar locations where you can go visit and make an appointment, and they will actually make a digital impression for you. So that's a nice alternative for patients who don't feel like they'll do a good job of this at home. Whichever method you choose, you then have your impressions sent either digitally if you go to the store or back in their box that they give you a shipping label for, and then their dental professionals will come up with a plan for you and send the trays back. Now, I don't know about you guys, but the term dental professionals makes me feel like they're not dentists who are reviewing this every step of the way. So that sort of makes me question, level of care that you're really receiving. They say it's the highest standard of care and really high quality, but me personally, I tend to question that just a little bit. So the biggest issue I really have with this goes back to you not seeing a dentist. So you do not have to see a dentist before you start on this clear aligner therapy. So they can't check your teeth and gums for health, and they don't know how the viability of this treatment is going to turn out, if it's even going to work for you, because not all cases of tooth malalignment are going to be solved with clear aligners. They do make you check a little box that says, I have been to the dentist in the last 18 months and they did an exam and an x-ray and cleanings and everything is good. But who's to say everybody's being truthful about that? You don't really know. They can just say that they've done it. And a lot can change in 18 months in your mouth, especially, if you change medications or habits or anything like that. So a lot can change in just a year and a half. The other issue, if you're not going to a dentist regularly to check you out while you're having these aligners done, is you can end up with tracking issues. And what that means is when the software comes up with the proposal for how the teeth are supposed to move, teeth don't always follow exactly because it's a computer and you're trying to simulate what will happen in the human body. So if your teeth aren't tracking properly and the trays aren't fitting properly, you're going to end up with an outcome that's less than ideal. So speaking of outcomes, if you look on these manufacturers' websites and you go to their before and after pictures, you'll actually be able to see some real patient treatments that have taken place. And in my humble opinion, I am not thrilled with the outcomes that they see on there. They're definitely an improvement, but they're far from perfect. I also read a whole bunch of reviews that had the same sentiments, that their teeth were improved, but they really weren't totally straight or totally perfect. So that was less than ideal. And the other thing I read online is that the customer service with these companies is really not great, and sometimes patients are waiting months to get their next set of aligners, which is really going to prolong their treatment time. So, bottom line with these guys, if you want to pay less than full price, expect a less than ideal outcome. And if it's not done properly the first time, you may wind up having to pay a second time to have it done properly. If you are interested in these clear aligners, please come visit us in our office. We just got a new iTero scanner. So what it does is it makes a digital impression, and immediately it can simulate what the projected outcome of your Invisalign treatment would be. So, Leo, do we have any questions from our audience?
Yeah, Shai Mendez asked, does Invisalign use licensed professionals or licensed dentists?
The question was, does Invisalign use licensed professionals or licensed dentists? Yes, so you have to have a dental license to be a participator with Invisalign, which we are here in our office. And basically what happens is the dentist will make all the necessary records, make sure you've got a clean bill of health on your teeth before you move forward with the treatment, and that you are a good candidate for Invisalign, because like I said, it's not necessarily a treatment for everybody, and some people should see, a specialized orthodontist who can treat you with regular braces, but we would be able to tell you that here. Then we take all your records, send everything out to Invisalign, tell them exactly what we want. We can give them a whole plan and say, we want these teeth to be expanded, contracted, whatever we want for the patient that we discussed with the patient, and then we get to approve the treatment plan on the back end. Plus, we're checking you, it varies on the treatment, but anywhere from every few weeks to every month or so, sometimes a little bit longer, depending on how complex the treatment is. So thank you for your question, Shaylee. Anything else?
And then Jody Solidor-Rodden asked, what is a dental professional?
A dental professional could include anything from a dental assistant, a dental technologist, even somebody who's like a dental sales rep who has a lot of background in the field of dentistry, which would still make them a dental professional, and I'm sure very good at their job, but it doesn't necessarily mean that they are a licensed dentist. So thank you for your question, Jody. Anything else?
Yes, and then Jody also asked, if the outcome is less than ideal, can't you end up with jaw pain?
Can you end up with
jaw
pain? Okay, so the question was, if the outcome is less than ideal, can you end up with jaw pain? Yes, that is definitely a possibility. If your bite doesn't end up in the right place when your treatment is complete, it can cause other issues with your temporomandibular joint and the muscles that are associated with it. So that's also a good question. Anything else?
And Shai Mendez asked, are scans better?
The question is, are scans better? The digital scans, they've come a long way in the last few years, and what a lot of the studies have shown is that they're actually more accurate than the traditional impressions, and definitely a lot more pleasant for patients to experience, because you're not dealing with the gooey impression material that has to sit in there for a few minutes at a time. The digital impressions are pretty quick, and we've gotten, we're very excited about being able to offer them in our practice.
Then I guess final question, how do you know if you are a good candidate? Does wearing braces as a kid make a difference?
How do you know if you're a good candidate, and does wearing braces as a kid make a difference? Clear aligners, like I said, they're for almost everybody. So whether or not you wore braces as a kid doesn't usually make a difference. Sometimes, what we see a lot of times in our practice is patients who wore braces and then didn't wear their retainers come back and they have a little bit of crowding or some space in between their teeth that they want to fix, and that's usually pretty straightforward. Does it matter whether or not you had it? No, we can still do Invisalign on patients regardless of your previous orthodontic status. Great. All right, so that's all the time we've got for today. Thank you so much for tuning into Reality Bites. As always, if you have any other questions, comments, you can message us on Facebook on the Gallery 57 page, or go to our website, gallery57dental.com. That's all the time we've got for now. Thanks for tuning in.